Thank you for joining us today as we discuss 21-2 tobacco in Atlanta, Georgia. We'll begin by introducing this healthcare problem. When a person starts using tobacco at a young age, they're at high risk of becoming dependent, which may make them even more likely to continue smoking into adulthood. Studies have been increasingly identifying the harms of smoking and recognizing how tobacco use can lead to serious health problems. As a person becomes dependent, they will begin to develop withdrawal symptoms without it. It makes it incredibly difficult to quit. The intent of increasing the legal age of tobacco sales is to prevent or decrease the number of youth that smoke, and therefore reduce the prevalence of smoking altogether. Now let's talk about the policy issue. The present law in Atlanta, Georgia details that it is unlawful to knowingly sell tobacco products or related objects to a person under the age of 18. As well, it is unlawful for any person under the age of 18 to purchase or attempt to purchase particular tobacco products or related objects. A huge concern is that the tobacco industry has actually conveyed that raising the legal age would be detrimental to one of their largest key markets of young adults aged 17 to 20. Legally increasing the age has been more effective when starting at a local level than expanding to statewide efforts. Areas where the policy has been enacted have found success in reducing youth smoking, but have also faced controversy from those who view it as being an intrusion and restriction of individual freedoms. The government has in fact made some response to this problem. Some of the actions imposed by the government in the state of Georgia include designation of smoking areas, taxing, control of funding for programs, sign posting requirements, vending, sales, and licensing requirements. You can see here the areas in which smoking is prohibited and areas where smoking is authorized. In Georgia, the tax rate on cigarettes was last changed in 2003. Prevention, control, and cessation programs are available under Georgia's controlled state funding. Businesses are required by law to display proper signage. Machine vending of tobacco or related products is not authorized in places accessible to persons under the age of 21, and license renewal fees must be paid annually for various business conduct related to tobacco or related products. In assessing current policy, it is found that the average minimum legal sales age for tobacco is 18. 3 states have a minimum age of 19. Progress is being made with the Tobacco 21 initiative, but there is still much to be done. Several states, cities, and counties have raised their tobacco sales age to 21, which makes many individuals covered. In 2015, Hawaii became the first state to implement Tobacco 21, and most recently in 2017, Oregon followed suit. In Georgia state law, there's currently no preemption language to keep localities from raising the legal age to 21, so local governments are free to enact their own ordinances. Hawaii and California both began at the local level before going statewide. Local champions spearheaded the issue by bringing it to the attention of the local citizens and government. Hawaii now has one of the lowest rates of high school smoking in the country and a below average rate of adult smoking, whereas in Georgia, the rates of both are above national average. Getting a bill passed can take more than a year. The process be that an attorney advises Georgia state Democratic and Republican legislators about the proposed bill of increasing the legal smoking age from 18 to 21. Part of the bill will include raising the cost of a pack of cigarettes, as the state would gain revenue from this. The legislator then files the proposed bill with the Secretary of the Senate. The bill is formally introduced a day after filing, gets assigned to a standing committee, and public hearings may be held for the members of the community affected to share their concerns. Eventually, the bill gets accepted by the House of Representatives and passed to the governor's office, who then signs the bill so it may become a law. Let's take a look at why we should advocate for this important change. Numerous studies show that by postponing legal smoking age to 21, smoking prevalence will be decreased and tobacco use would drop. Understanding that those who purchase cigarettes from minors are between the ages of 19 and 21 themselves will help us to understand how increasing the age limit would decrease youngster smoking access and initiation. Unfortunately, 95% of smokers started smoking before 21, so increasing the age limit would be instrumental in deterring teen experimentation with cigarettes from turning into habitual smoking. Campaign for Tobacco-Free Kids conveys that increasing the tobacco sales age to 21 would produce immense health benefits. With this change, there would be fewer premature deaths and fewer lung cancer deaths. Nurses have a great deal of respect among the general population as well as amongst legislators and media leaders. Nurses can get involved in legislation initiatives in numerous ways. They may disseminate research literature in the media, participate in developing professional organization statements relating to smoking control, and/or advocate the ban of tobacco advertising to youth. They may also conduct further research projects on the harms caused by tobacco use and address legislators with evidence-based research findings. Nurses can study the effectiveness of smoking cessation or prevention programs and the cost to society. Implementation of any bill takes time to happen. However, showing lawmakers that everyone can benefit from increasing the smoking age to 21 years old is key. One way of getting support for the bill is to show how the state will benefit from an increase in the cost of cigarettes. Increasing the cost to $5.30 per pack will not only make buying cigarettes more expensive, but will increase tax revenue. 100 smokers would be an average of about $7,500 revenue gain for the state. Another part of getting the age increased implementation plan would be to have tobacco sellers post signs that it is now illegal to sell tobacco products to anyone under the age of 21, and proof of identification is required. Flyers can also be distributed to all high schools in the state as to when the new law will come into effect and the ramifications of getting caught smoking under the age of 21. We have a duty to our children to make sure that we teach them to live a healthy lifestyle. Early age tobacco use can lead to many health issues, including oral, throat, and lung cancers, emphysema, chronic bronchitis, and premature births. By increasing the age to buy cigarettes from 18 to 21, there can be a reduction in those that start smoking and these negative health outcomes. Also, the state would benefit by raising the cost of a pack of cigarettes and have an increased amount of tax revenue that they can allot towards smoking cessation information and programs.